Okay, last time we left off, we were talking about cross-sectional studies and ecologic studies or correlational studies. So we hadn't got into the correlational studies yet. So in our second part on major study designs and study methods, we're still focusing on observational studies versus experimental. And we're going to talk a little bit about correlational or ecologic studies. Again, this type of study design does allow for a statistical analysis approach, but it does have a lot of flaws to it compared to other approaches that are used in biostatistics and epidemiology. So in these particular types of studies, unlike the cross-sectional studies, correlation studies, they use data from entire populations to compare disease frequencies or maybe an exposure frequency between different populations. So we may be interested in comparing the prevalence of e-cigarette use in one county versus another, or in the 120 Kentucky counties versus the 88 Ohio counties. So those are the types of things we can do with correlational ecologic studies. We may also compare diseases like asthma frequency and across Kentucky counties versus Ohio counties, or asthma prevalence among Kentuckians versus other states, or obesity, or whatever it might be. But again, the unit of analysis here is going to be more population based. So we can compare two or more populations during the same period of time. So we can compare, again, like, for 2017, what is the e-cigarette usage rate across Kentucky versus the 2017 rate across Ohio, assuming that the data have been collected and are organized in some sort of aggregated way. Again, the individual level data would be way better, but if all that you've got is population level data, because that's all the state will release, or that's all the feds will release, then that might be all that you've got to use. We can also look at historical trends, time trends. So we might have the same type of data from like 2000, 2005, 2010, 2015 for all of Kentucky on something like cigarette smoking and the prevalence of daily cigarette smoking, and you might be able to see whether or not it's rising or falling, or the prevalence of obesity based off of BMI data, whether it's a good marker of obesity or not. I mean, that's how they do it. So you could get county level or state level BMI data and then see how things change over time and see if we're becoming more or less obese. Again, the unit of analysis in correlational or ecologic studies, this is different than the other type of studies we're going to talk about. The unit of analysis is the population level. So the data may have came from some other cross-sectional studies, could have been from the behavior risk factor surveillance study, or a study done by researchers, but at some point the data were organized at the population level, and that's what makes it more ecologic. An example would be downloading data from something like the CDC Wonder, where you can download mortality data for every county in the United States, and you may get the age-adjusted mortality rate for pneumonia and influenza for a certain period of time from 1990 to 2016 or something. When you download that data from CDC, it's organized at the county level. These are not individuals. These are all the people in the county who died from pneumonia or flu in this example, and then it's divided by the total population, and we get this age-adjusted rate. We don't know which people in that group were smokers. We don't know which people in that group had alcohol. We don't know which people in that group had high school education, no high school education, college education. We do know things like the percentage of the people in the county that had an education that was like that. We do know the percentage of the people in the county that smoked, in this case 20.2%. But again, it's all organized at the county level. That makes it a correlational design or an ecologic design. We can take ecologic data and we can put them on a map. So this is obesity data in 2011. So you can see Kentucky on the map, I think was that color orange. Looks like a 30% to 32% obese. Mississippi and Louisiana over 32.5% obese. We've got state level data. Doesn't mean everyone in Mississippi is 32.5%, obese or anything like that. It just telling you the prevalence of obesity in that state. It's all aggregated. These ecologic, or also known as correlational study designs, they are quite simple, and it's very easy to look at geographical differences across states by just plotting it on a map. That's often the simplest design. Generally speaking, they often should just be used mainly for describing, but some people may choose to use them as exploring a hypothesis or maybe enhancing a research grant. If it's all you got, it's probably better than nothing. So it does help. Now, we can take this type of data and do multiple group ecologic study comparisons. We can plot average exposure levels for the county, like the percentage of people exposed to something, or the number of bad air days for fine particulate matter, and the percentage of people who have asthma, or the rate of heart attack in a county versus the prevalence of obesity in the county, or the rate of heart attack versus the rate of poor air quality days. Again, it's all at the county or state or census tract or school level. It's all organized by group. The data can be presented graphically, and a measure of the strength of association can also be presented. So later on in the course, we're going to use data to do linear regression analysis, and you'll be able to do something like this. In this case, on our bottom axis here, the bottom axis, we call this is our x-axis. Here's our y-axis, our response variable. This is our predictor. And this could be the lung cancer rate over a certain period of time. 100 cases per, so many 100,000 people, or 100 cases per 100,000 people. This could be, these counties, they don't smoke very much. They have very low lung cancer rate, way below our regression line. So this is all state level data here. These were states. These were individual states. The state that smokes the most was at 27% or so, 28% that currently smokes. In this state, very low prevalence, apparently, 8 or 9, 7% or something. So we can also look at changes in a particular community. So in this example that we just looked at, this is all the states compared to one another. But we can also look at changes in a single population over time, where we might have data collected from some sort of common survey approach every 5 or 10 years. Maybe not the same people, but the survey does collect that kind of data from the same kind of group or the same sample population every 5, 10, 15, or maybe even every year. And then we can look at changes in some sort of exposure to a pollutant, or changes to some sort of exposure or intervention, or look at changes in maybe the frequency of a disease or bad health outcome. Again, though, these are still not individual level data. We're looking at population level data, and we can use this kind of data to maybe make it into a newspaper or help enhance a grant application. It is often easy to see whether or not a potential trend is there or not. We may not know the cause of the trend, but it definitely will sometimes warrant some sort of hypothesis. So in this case, this is an example of a single time trend here that's on this black line for the USA, where we have data from these years collected from different surveys, where these X's are, same kind of survey, and every so many years they do it, and this is the obesity rate where they calculate it based off of the height and the body weight of the participants, and then we have the percentage of the population in those studies that was obese. And then they have similar types of data for these other countries. So this is a time trend ecologic study. Again, the unit of analysis is the population. So in this case, who's the unit of analysis? It's the entire United States. It's aggregated for the whole country. These study types, the correlational ecologic ones, some advantages. They're really quick. Often the data are already available through maybe like Robert Wood Johnson Foundation supports Wisconsin's Population Institute, so you have the ability to download data from county health rankings, or CDC Wonder, or the Environmental Health Tracking Network from CDC, or the National Cancer Institute runs the SEER program, where you can get county level cancer data. So it's quick to just download the data. It's not expensive. You can collect data from different sources and link them by this thing called the FIPS code. I'm scrolling back so you can see it. There's this thing called the FIPS code. So these data came from one source. These smoking data came from another source, but we link them by FIPS code. So you can really do a lot of very simple statistical analyses quite quickly and not expensively. And if you've got routinely collected data, it's pretty easy to do. They're easy to explain, just simple regression that we'll do later on, a graph, a scatter plot, X versus Y. And they can be useful for generating a hypothesis or several hypotheses. However, there are some major disadvantages of these types of study designs. Not to say that we should throw them out, but often not often, always, it's hard to link the exposure. So just because the air quality is bad doesn't mean that the people who had the heart attacks or had the asthma were actually exposed to it. They could have been indoors with good air conditioning and good air filtration. So we can't always link the exposure to the disease. Also, just because we know things like smoking are confounders, and because we have the population level smoking data, we might be able to control to some degree the confounding for the county level data. But for trying to make assumptions about individuals, we can't sort out who's smoking and who's not smoking in ecologic data. We can only look at the percentages for the counties, so we cannot control for individual level confounders. And it's really hard to test our hypothesis. We can't test it at the individual level. We can only generate a hypothesis that may be applicable at the individual level, but future studies would be needed. Therefore, ecologic studies are inadequate in trying to claim causality, and all studies struggle with trying to claim causality, but these are the furthest reach for being able to explain causality. So there's this unique situation in ecologic studies where a relationship between an exposure and a disease at the population level may not hold true at the individual level. So an example that was given was this Durkheim paper, and this was published, I guess this was in one of Morgenstern's papers, but it references this Durkheim study, where as the proportion of the population that was Protestant went up, the suicide rate went up. So the Catholics said, oh, well, these Protestants must be killing themselves. Well, it turns out the reason why people were killing themselves, it had nothing to do with whether they were Protestant or not. It probably had something to do with the fact that whether they're being martyrs or not for not converting to a certain faith or something along those lines. There were some underlying reasons, and it turned out it wasn't the actual Protestants that were the most frequently killing themselves. It was actually the Catholics living among these Protestants that were the ones killing themselves. So just because we have some relationship doesn't mean it always holds true at the individual level. So you can pause this slide and look at it. You should be able to answer all these questions for your potential exam at some point, and we can review them and maybe hear later. Thank you.